Hello and welcome to Aging is for Everyone. I'm Laura Mondello and I'm your host for the show. Paying for healthcare is a big topic in the news. It's also a hot topic whenever I speak with older adults and their caregivers. It's so important that today's whole show is devoted to paying for healthcare. I'm happy to welcome Nancy Schneider from the Erie County Department of Senior Services Insurance Outreach Program. Thanks for being with us, Nancy.
Happy to be here.
Well, we asked you here today to talk about Medicare, which is something that a lot of people have a lot of questions about, and
Yes.
and that's something that you can help us out with. Let's start with some of the basics. Who's eligible for Medicare and when do you apply?
Okay. When people turn 65, if they've worked and put into the system, they're eligible for Medicare A and B. If you're disabled, or if you're the spouse of a disabled person, you can become eligible at an earlier age. Okay? If you're disabled, it takes 2 years. You're disabled, declared disabled, then 2 years later you're eligible for Medicare. If you are just retiring, 65, the day you're 65, you can, actually, the month of that you turn 65, the first day of the month that you turn 65, you're eligible for Medicare.
Okay, so for most people, 65
Yes.
is the magic age. Okay. Medicare has a lot of different parts. You mentioned A and B. Can you briefly explain the different parts of Medicare and what they do?
Sure.
Why you would need them?
Medicare Part A is your hospital benefit. That's what you would use if you went into the hospital. Medicare Part B is your medical benefit. It's going to cover your doctors, your durable medical equipment, your x-rays, any of those tests that the doctors can now think of to give you.
Right.
That's what your Part B is. Then Part D is D as in drugs, and that covers your prescriptions. The other thing that's available out there is what they call Part C, but if we're going to be talking about different ways to get your coverage, Part C is one of them. It's actually managed care plans.
Okay, okay, and would that be like the Medicare Advantage plans?
Yes,
Or, okay.
exactly.
Because that was my next question.
Oh,
You know,
okay.
what are like the Medigap? What's the difference between a Medigap plan and a Medicare Advantage
Well, there's a big
plan?
difference.
Okay.
With a Medigap plan, okay, they're either called Medigaps or supplemental plans. Your Medicare A and B is your primary coverage. You use that first, then this plan, these types of plans wrap around. So anything your Medicare A and B is going to cover, this supplemental plan will fill in. Okay? Now with the Advantage plans or the managed care plans, that takes over your Medicare. That card that you get from whatever company you choose, that's going to take over your A and your B. You use it for your doctor, your x-rays, your hospitalization, anything like that. Most of the Advantage plans, not all of them, but most of them also have your Part D built into it.
Okay, so those are like the HMO type plans?
Yeah, there's all different kinds. Well,
Right.
there's a couple different kinds.
Okay.
The most common in this area are HMOs, health management organizations, or PPOs, preferred provider organizations. There's also something called a private fee for service. And if different needs are going to make you decide which plan is the better plan for you.
Okay.
Yeah.
Okay. So just to backtrack a little to the Medigap plan, those plans basically would pay what Medicare doesn't pay.
Right.
And then
Exactly.
fill in for some of those copays
It will fill
that
in
you
for
would be
right.
responsible for.
And depending
for
on which
Medicare.
type of plan you purchase, some of them will cover just your excess hospital costs. And right down the line to a plan that covers everything, you have no copays
Okay.
for anything for your hospital or your doctor.
Okay.
Yeah.
And then the Medicare Advantage plans, as I said, are sort of like, they're going to cover a little different.
They're going to cover differently. What happens is the managed care plans take over your A and B, okay? And with those plans, there's no big surprises, but there's a copay for everything you do.
Okay.
But if, like you should, you read what your plan is going to provide and what your copays are, there's no surprises.
Right, right. Now, there's only certain times when you can change your plan. For instance, if you're in a plan, you can't just decide, I'm going to change my plan
Right.
without.
Okay.
Okay.
The most changes are made this time of year. It's open enrollment between October 15th and December 7th, Pearl Harbor Day. You have the opportunity to change your plan. Everyone who's on Medicare does. And actually this time of year, the plans all change too.
Okay.
Okay, this is a real important time of year to be reviewing what you have and looking what the other guys have if you're not sure about your own coverage. Now, the other times that you can change plans is if you're newly on Medicare.
Okay.
Okay, you have a period of time after, let's say you choose a managed care plan and you don't like it. During that first year, you can change again. Okay, in New York State, there's a couple of extra exceptions to the rule. One of which being if you are an Epic, you can change one more time during the year.
Okay.
Okay, if you have certain subsidies, it makes you eligible to be able to change at any time during the year. But in general, between October 15th and December 7th is when you can change your plan.
Okay, so this is when, if people are on Medicare right now and they want to change their plan, they should really be looking over the information.
Yes,
and,
definitely.
You know,
This is the time.
maybe the company that they're with, they've changed the drugs that you can get through the plan.
Exactly.
I would assume that's probably a big thing that people would look at.
Big thing is the changes in the formulary. That's the list of drugs. The other big thing is different copays. You can't assume that because you were pleased with the plan that you had this year in 2012 that it's going to be the same.
Okay.
In 2013, you really need to review the information they send you. I know it's boring. I know you'd rather do anything else.
Right.
But this is the time to do that, and it's really important so you don't have any big nasty surprises in January.
Right. A lot of times people are doing this for their parents too, and maybe
Yes.
they have questions and they don't really know. How can somebody get help with this? Because this is really a big thing.
I work for the Health Insurance Counseling Department at Senior Services, and that is strictly what our little office does. It helps people decide which plan they need, which plan to choose, if they're going to move or if they're going to change their situation. We help caregivers. We work with anybody to help figure out what it is you need. In fact, we can even work with younger people who are on Medicare. We have no age, just because we're from Senior Services, we don't have an age restriction.
Okay, so anybody who really has questions, they can give you a call. And I know you also have trained volunteers that are out.
Yeah, we do. We have some trained volunteers out in the community. You would call our number anyways, and we'd get you in contact with them.
Okay.
Okay. Some of them have set hours at a location, but you have to make an appointment.
And then
with us, you can call, and we do most of our counseling over the phone.
Great.
So you don't have to.
Because we don't want people sitting out there thinking this is so difficult to understand, and they're just staying with the same program, even though it may not be the best thing.
You know
for
what?
them.
You're right, Laura. It is very difficult to understand. There's no two ways about it. It's confusing, but that's exactly what we do. And what we do is we try and get your information, just narrow everything down till we get to where you need to be.
Great.
You know, not every plan is for everybody.
Great. Well, thank you so much for being with us. Hopefully you'll get a lot of calls.
I would think that's probably going to happen.
Okay.
Thank you.
We'll be right back with more Aging is for Everyone.